I am Becky Sznejkowski, which is absolutely ridiculous. It's taken me, probably 6 years to be able to say it, spell it. I feel like my children are going to be the last ones in the classroom trying to spell their name. Most people just call me Dr. Becky, pronouns she, her, hers. I am a clinical psychologist. I work at Cal Poly in the counseling center, but I think my most important role probably of why I am here is as a cancer survivor. So I'm very honored to be here. It's been interesting putting this together, just thinking about my story. Obviously I know it, but I mean, y'all know chemo brain, right? And so, I haven't really gone through and thought about it in as much detail. So I'm just honored to be able to be here. But what I want to do is tell you a little bit about my story. And I know you probably read some of it, but I'll go over a little bit about my story, and then I'll switch into some things we're going to talk about from like a professional mode of some strategies. Okay. So next slide, please.
Maybe.
There we go. Okay. So I was diagnosed at age 32, and I'm actually a 12-year survivor. I think that said 14, but either way, math is hard. If you do the math, I'm still a dinosaur, no matter what that is. But when I was diagnosed, I'm glad they took it seriously. Basically, they were like, you don't have any risk factors. It's probably not cancer, but we're going to send you just in case. I think I had a 1% chance of getting cancer. I think actually my only risk factor was I was 32 and had never had a tiny human claw its way out of my body. That was basically like my only risk factor. And when I went to get my mammogram, there wasn't even a checkbox for my age. It was basically like 50. And I'm like, do I get a different form? And they're like, nope, write it in. Excuse me. So that was 12 years ago. And I will tell you, chemo brain is a thing, age is a thing, but you do start to forget some of the dates. And I feel like that could be a good thing, just because like I will celebrate my cancerversary when I was diagnosed. And then shout out to my mom who's here tonight. She will text me like the next day. And I'm like, wait, I thought it was like yesterday. And she's like, nope, it's in my phone. So you do start to forget some of those dates. I chose a different surgery than what the doctors suggested. They're like lumpectomy, or we'll just remove the one breast with the cancer. I was like, They tried to kill me, cut them off, make them bigger. And they're like, But in California, there's a lot of things about California that we may or may not appreciate. But in California, I got to make that decision, and it was covered by insurance. And because my mom is here, I'm going to share this, that I did not have a very big chest. And so basically the plastic surgeon was like, the best thing, if you're going to do this, it's going to make it easier, and it's going to probably look how I want, is just to do a bilateral mastectomy, which is what I chose. And I grew up very small chested. And I remember in 6th grade, I would pray for God to make my boobs bigger so I would fit in, so I could look like everybody else. My mom said, young lady, that is not how God works. And it only took 32 years. I should have specified in my prayers how I wanted to get bigger boobs. So I chose that surgery. I made them bigger. My family is really far away. My mom is joining us from 2,000 miles away. And so I didn't have family here. I really had to rely on my friends, the people in my life. At that point, I was 3 months past my 1-year anniversary of my practice marriage, my first practice husband. So that was really hard, being into a new marriage and getting this news and trying to figure out what the heck am I going to do with this. I am a psychologist. I look at research. I tried to argue for radiation or against radiation. I chose a surgery that they didn't recommend, and I had chemo. I had all the hard stuff, makes your hair fall out. You get to wear the wigs and do all the really uncomfortable things. And my oncologist was on board, but the radiation guy was like, you're young. You didn't have a lot of risk factors. If you were my wife, my partner, my daughter, my anything, I would want to throw everything at you and the kitchen sink. And I'm like, you got a good point. So I did it all. I followed their recommendations. Okay, next slide, please. And I think we've all gone through this, why me, right? It's like, why me? And it's really hard. I know. I remember when I first got the diagnosis, they were like, there's never really a rhyme or reason. It's kind of like God's at the grocery store and he points and he says, you. And there's really no rhyme or reason. And it took me a really long time. I don't want you to see this why not me and think, oh my gosh, that was magic that happened for me in 5 minutes. It did not. It was really scary, but I was like, I don't really have a choice in this. Kind of like when people are like, oh my gosh, you're so strong. And you might get kind of frustrated because you're like, I don't want to be strong. Like, I don't have a choice in this. So I'm like, okay, bring it on. What are we going to do? But when I think about this, I think about all of the people that it brought into my life. I call them my cancer posse. And some of those people are here. I met Shannon through the San Luis Young Survivors group. I showed up all scared to death, deer in the headlights, like had no idea what was happening in my life. I was working in prison at the time. I did not want to be bald around inmates. I met my chemo sister. And during my second round of chemo, believe it or not, she was younger than me. And we went through every round together. We would chat for 3 hours. I would pick a different person to come to chemo with me. I would kind of just try to make it a thing. We would be all chatty and then the liquid Benadryl would come in and then we would be loopy and everybody would laugh at our conversations. But I really had to rely on those people around me. It also eventually brought Lauren into my life, who you all now know. So this is kind of amazing for me to be here that this has come full circle. And I had a really hard time accepting help. I was out here being my independent psychologist working in a prison. Oh my gosh, my friends wanted to cook for me, clean for me, drive me to appointments. I'm like, no, I can do this. And then somebody that I worked with was like, listen, we feel so helpless. There is nothing we can do for you. Let us do this. And I have never forgotten that. And I still use that in my professional life of like, look, people care about you and they can't do anything either. They feel so out of control. Let them help. And what my staff or my colleagues at the prison did, I wore a hat over my wig because I had this fear. I was going to be walking across the yard at the prison and there was going to be a gust of wind and my wig was going to go everywhere. And the inmates were going to be like, what the heck? So I would wear a hat, and one day a week, everybody in my building would wear a hat with me. And I actually thought that was super cool because it was one day out of the week. I did not feel so singled out. I did not feel like the world was staring at me, which was really amazing when I think about it. And honestly, I think cancer prepared me for where I am now in my life. The person that I was 12 years ago would not have been able to handle divorce. I would not have been able to do the foster to adopt, which I will talk about in a minute. That person would have run for the hills. And my motto now is if divorce and cancer didn't kill me, nothing will. So I really feel like when things are thrown at me, it's really freaking scary, but I'm like, okay, like I was given this for a reason. And, I wanted kids my whole life. And again, I guess you have to be really specific when you pray because I wanted kids and it was like, well, this is the route we're going to give you to get there. It also really helped me for my private practice. I do a private practice one night a week. I got really into nutrition, through my cancer journey. I'm like, what can I control? Because most of the time it's nothing. I was still going to the gym. Instead of like an hour on the treadmill, it was maybe 2 minutes, but I was like, okay, I'm just going to like do what I can. But it really got me interested in nutrition. I started getting some certifications. I got a certification in nutrition and mental health. And I just really started thinking about who can I impact and how can this story help me help other people? And so I really have been, my practice, I started it because I wanted people to come and see me who weren't in prison that actually wanted to come to therapy. But then I started realizing there are survivors, there are people going through treatment, there are caregivers and supporters, and they all need help. And I'm a psychologist and I've been through it. So it really helped me decide like, this is what I want to do. By the way, if you hear anything in the background, there are no children being harmed in the making of this. They're just here, so you may hear some screaming. The other thing is I became what I call a flexitarian. I don't really say vegan because I'm not the person in the restaurant going, what's in my food? So maybe it's a hypocrite, but I say flexitarian. I was actually vegetarian for 8 years before I got cancer. And I'm not saying you have to be vegan. That's not on my like strategy that I'm going to teach you today. But for me, with the research, I just chose that path because I really want to make my body a place where cancer doesn't want to return. And that just helped me solidify that for myself. Okay, next slide, please. All right. My big question was like, did cancer prevent me from having kids? And I will never know. I did go to a specialist in the area. And at first he's like, oh, you've had chemo and radiation. Like, good luck. It is just not going to be in the cards for you. And then he realized, oh my gosh, you're really freaking healthy. But he said, you will never be able to get pregnant. He was not correct. I was able to get pregnant 4 times. I was not able to grow a tiny human past 8 weeks. And so that was really hard. And again, me before cancer would not have been able to like navigate that at all. And I decided, like, short of stealing a child, because I had worked in prison forever and was determined not to go to prison, I was going to find a way to get kids. So here they are. And that is my now husband, my forever husband. And that's how we met Lauren. We decided to go through foster to adopt, which is an intense process. We survived. And these are my babies. Rosa will be 5 in September. We finalized adoption when she was 14 months old. 3 months later, they called me, the grandparents, because we are still really close with their biological family, their grandparents and their siblings. And the grandpa called me and he's like, guess what? Rosa has a full biological sister. Do you want her? And I'm like, yep. I'm like, we will figure out how to do this. But I think this whole journey like prepared me for the hardest and most rewarding job ever of parenting. So if any of you are parents, you can kind of relate that it is not for the faint of heart. And again, as I mentioned earlier, it also just led me to really wanting to get some certifications in how can I help people with a holistic approach? Like, how can you take care of your bodies, not just physically, but mentally and emotionally, because stress is huge. You're going through treatment or just being a human, stress takes a toll. So I just wanted to throw in a picture of my kids. Okay, next slide, please. All right, let's talk emotions and let's act. It's kind of a pun because I'm going to say act because we're going to act. But I want to tell you a little bit about this therapy. And I realize that you're all muted. So one of the things I'll just have you think about instead of shouting it out. But a couple of disclaimers before I go over this. I teach an 8-week group at Cal Poly that I've been doing for 6 years. I'm cramming in probably 20 minutes worth of stuff from an 8-week group. So you may be like, what? And you may say, Dr. Becky, I'm hanging up on this call because I don't believe you. But I was going to bring in a bunch of research. For most people, it makes us fall asleep. But when I was looking at it, act-based therapy is really recommended for cancer patients, for trauma, for depression, for anxiety, for all the things. And it is really difficult to describe what it is. So what I want to do before I go into some of the things we're going to practice, I invite you, if you have something next to you, like a piece of paper, a notebook, something that you can hold in your hand. Since you're muted, nobody has to say anything. But I want you to have it in front of you. And I want for you to pretend that on this note, I'll just show you my little notebook. On your notebook are all the thoughts that you don't like. The scary thoughts, the anxiety thoughts, the sad thoughts, the emotions you don't like, depression, anxiety, fear, the physiological sensations. My heart's racing, I'm shaking, I have butterflies in my stomach, all those things, those urges, memories, all of it is right here. Now, what I want for you to do, if you're willing, is put it up to your face where it's touching your nose. So if I'm doing this, I hope you can still hear me, but if I'm doing this, you can barely hear me. I cannot engage in a conversation with you. I am all caught up, right? I'm all caught up in these thoughts, these emotions, these physical sensations. Like, it is right here and I cannot do anything. I'm not living the life that I want to be living. So now our instinct is, I'm going to hold it out here. All of these thoughts and emotions and physical sensations. Now I'm pretty strong. There's no way I could do this for hours or days or weeks or years, right? So then what do we want to do? We want to throw it on the floor. I don't want to have these thoughts. I don't want to have these emotions. I don't want to feel how I'm feeling. Now I know you can't see my lap, but I'm going to take this and I'm going to put it in my lap. So now if I put it in my lap, it's still here with me. Now I can use my hands too much to talk. I could go walk my dog. I could play piano. I could hug a loved one. I can live life and it's still with me. The difference is it's not driving my car of life. And so ACT uses a lot of metaphors. But one of the things I love to think about is we're driving our car of life. And we have all these thoughts and emotions that we really don't like. And so it has us turn our car in circles. And now we're spinning in circles because we're so caught up in this stuff. It's like doing this. But what this helps us do with practicing, it takes practice. All of this can make sense, but then you could leave here and go, what the heck? It doesn't work with one try. It takes lots of practice. We can put this to the side and say, where are my values? How can I drive my car in that direction? So it's very counterintuitive. I see a lot of people that come to me and they're like, I don't want to have these thoughts. And I'm like, well, we have 60,000 to 90,000 thoughts a day. We don't get to get them out of our brain, right? It's our internal experience. And it's kind of like saying, I want my heart to stop. Nobody wants their heart to stop. So we can't stop our brain from doing what it's designed to do. And the reason I say it's counterintuitive is because our instinct is to stay alive, right? Evolutionary, that's how we are all sitting here today. So think about it. If you saw a bear in the woods, you would not want to have to think, oh my gosh, there's a bear. It is so cute. It is so fuzzy. Can I pet it? Or if you were my 3-year-old, I want to hold it. Like your body says, danger, get the heck out. So you either run away, you try to fight it, or you freeze, right? And that's how we have stayed alive as humans. What ACT is telling us to do is to say, this is my internal experience. And the more I get caught up in the struggle, I can't live my life. And so what happens, us as humans, because we have a brain, our brain is always telling us doom and gloom stories. And your body doesn't know, is it a bear that's about to eat you? Is it a scary appointment with the doctor? Am I about to have chemo? Am I going for a 10-year scan? Like it just says danger and it wants to run. It's values-based. I think that's what really connected me to this is thinking about your why. I'm sure you've all heard that. What's your why? But for me, I really think about, I don't want cancer to live in my body. I don't want it to come back. And so I really connect with my value for my health and my value of how I want to be as a mom. I really want to be patient, nurturing, loving. I screw it up every day, all the time. But no matter how much I screw it up, I can always choose an action that is towards that value. So I like to say our butt gets in the way. I want to work out, but I don't have motivation. I want to go to work, but I don't want to, right? And I always tell people if I went to work on days I felt like it, I would never go to work. So this helps us realize I can have this anxiety. I can notice this feeling in my stomach and my heart's racing, and I can carry that with me in my lap or as a passenger in my car, and I can drive towards my values. So that's what really, I think, resonated with me when I first started learning about this. Now, this is the hard part. The last one on here that most people don't like is we want to control our thoughts and our emotions, right? We don't get to. Like I said, there's 60,000 to 90,000 thoughts, but we spend so much time trying to control them that now it's a losing battle. One thing I want to make sure I mention, because I know I don't have a lot of time to talk about values, is a lot of times you may not know what your values are until they're overturned by life. Thanks COVID, like thanks cancer, right? Like if you can't go out with your friends, if you can't hug people, if you can't move your body, that's starting to show you what's important for you. And I think that's beautiful because now we can connect. Now we can say, I know this is something that is meaningful for me. I don't have to feel like it, but how can I show up while I feel anxiety, while I feel depression? I want to give you a little example for some of you who are like, I can control my thoughts. I can stop them. So you don't have to say anything, but what I want for you to do is I'm going to give you a second to prepare. I don't want for you to think about the next thing that I'm going to say. You can do anything but mute me and cover your ears. Okay. I'll give you a second to prepare. So don't think about vanilla ice cream. Don't think about how creamy it is with cherries, chocolate sauce, nuts if you like nuts, right? I could keep going. Some of you may like raise your hand and go, I didn't think about it. And then I'll say, what didn't you think about? And you'll say ice cream. So that just shows us that whenever we have this, I don't want to think about my appointment on Monday. I don't want to think about what my test results are going to be. I don't want to think about chemo. Here we are thinking about it, right? Now we're back here going, here it is. So then we just have this war. We get so caught up in our agenda to control our thoughts and emotions. Life is going on without us. Now we're not seeing our tiny humans. Now we're not hanging out with our friends. Now we're not doing all the things. So that's where this is very counterintuitive, because it is really hard to just sit there and go, okay, I'm going to let those happen. One of the metaphors that ACT uses is quicksand. Has anybody ever been in quicksand? Like, I have used this for 6 years and we all know what it is, but I've never met a person that's like been in quicksand. But what happens if you're in quicksand? It's really scary and we fight it. We try to resist and it sucks you under, right? The only way to get out of it is we have to expand, open up, and lean in, which is not fun, but it's how we then rise up. And so the point of ACT, which is acceptance and commitment therapy, as you can see here, is not to stop our thoughts, stop our emotions, but to become mindful. And when we become mindful, we can notice, but then have the freedom to choose our next action. Now, some of you, when I said mindfulness, may have a fear that I'm about to make you sit down and go, I'm not. The only thing I'm saying about mindfulness is we are becoming an observer. We're becoming an observer of those fun thoughts that go through our brain, those fun emotions. And instead of saying, oh my gosh, I got to stop it, we're going to say, what's the next action I can choose in line with my values? And so that's where it's very counterintuitive, right? And so what they call it is cognitive diffusion. It's just the fancy word to try to unhook from your thoughts, because our brain is a monkey mind and it is going all the time, right? It is running all over the place, telling us stories. And some of those stories are super helpful. Like, hey, I haven't eaten today, or hey, I need to pee. Okay, cool. We should listen to that. But sometimes it's like, oh my gosh, I'm going for my 10-year appointment. Maybe my cancer's back. Oh my gosh, then this is going to happen. Then this is going to happen, right? In this current moment, that's not where we are. And so being able to slow down and step back from those thoughts, we get to realize I'm the person having the thoughts. I am not the thoughts. And that is really powerful. Okay, we will go to the next slide, please. We're going to practice a couple of things. All right, so what I was going to do is have you all like chime in some things, but what I will just have you think about, and I'll just give you my examples. What I want for you to think about is, what have you tried? So think about if it's like anxiety, depression, physical sensations of anxiety, all the internal stuff that you don't like and wish you could get rid of. What are some of the things that you have tried to get rid of it and to control it? So I'll just give you a second to kind of think about that. When I do this in my group at Cal Poly, like I'll throw out like exercise. Sometimes I'll throw out like wine. That one's a tricky one, right? Like too much is not going to be a good thing. Maybe you've done therapy, self-help. Maybe you've turned to something not so helpful. Maybe you isolate, maybe you overeat, maybe you've even tried self-harm. But I was going to have us create this list, but you can probably just think of some of those things that you've tried. Maybe you go for a walk. Maybe you connect with friends. There are so many things, if we created a list, that could be things that you have done to try to not feel how you feel and to not think those thoughts. And some of those ways are really helpful. Going to work out, petting a dog, being with your friends, using your cancer posse in your community, going to groups, all of those things are amazing. But yet here we are in this virtual space together, all still having anxious thoughts, sad thoughts, emotions we don't like, physiological sensations. So no matter what here we are still having that experience. So kind of the point of that is to say, we don't get to control it and stop it. Okay, so the unwanted party guest. I don't know if this is going to work, because if you were here in the beginning, my new computer failed me with being able to share all of this. So I tried to send it to Shannon. It's like 4 minutes. I just wanted to show you something that like gives you an idea of what I'm talking about.
Imagine one day you decide to throw a party for all your friends. You get out your phone and you start inviting people. You want a really big party, so you say, anyone can come. And on the big day, you get your place ready for the party, and you're really excited to see everyone. And pretty soon, the guests all start arriving. After a while, everyone you're expecting has arrived, and you're having a really good time. But then the doorbell goes, and you think, I wonder who that is. Must be someone I've forgotten about. And it is. Someone who you definitely did not want at the party. It's your neighbour Brian. Brian has to be one of the most annoying people you know. He's rude, grumpy, he moans a lot, and he's not so flash on personal hygiene. He's the last person you want at your party. But before you know it, he goes straight inside without even saying hello. And he goes up to your guests and he's rude. He helps himself to drinks and food. And he generally acts a little weird towards your friends. And understandably, you feel pretty upset, embarrassed and angry. And before long, you go over to Brian and tell him, that's it, it's time for you to go. And you throw him out of your party. Once he's gone, you feel relieved. You go back to the party and start to enjoy yourself. But after a while, you hear the doorbell again. And when you go to check who it is, you realize Brian has come back. And before you can stop him, he opens the door and races back into the party. So you go out and get him and throw him out again. This time though, you decide you're going to make sure he doesn't come back. So you decide to stand by the door and make sure he can't get back in. And this works fine. Brian can't get back in and you feel good about this. Trouble is, you realize that all the while you're missing out on the party. You can hear everyone else outside having a good time. You want to be out at the party too. But because you can't stand Brian, you can't risk him coming back in again. And you don't know what to do. You really want to enjoy the party, but the thought of Brian being there really gets to you. After a while, you realize that, actually, this party is pretty important to you, and you want to be with your friends, at the very least just to make sure they're okay. So you decide to go back out, and you say to yourself, if Brian comes out, that's how it goes. And sure enough, after a couple of minutes, Brian comes back in and starts being annoying again. But this time something's different. You don't ignore him, because he's pretty hard to ignore, but you decide just to get on with the party and talk with your friends, and you start to notice some interesting things. First, you find that even though Brian is still there, you're actually having an okay time. Sure, it'd be better if he went home, but at least you're not stuck at the door, missing out on the party. Second, you notice that when you're not trying to get rid of him all the time, he calms down a little bit. He's still a pain and still smells, but he's not so rowdy. And then after that, you start to notice some other things about Brian you hadn't actually seen before. Like that he has a quirky sense of humour, even though it's buried pretty deep. And he even makes a couple of friends of yours laugh. And you wonder to yourself, what will you do next time you have a party?
Okay. Thank you.
Uh-oh.
That's okay. So first of all, anybody notice they have no arms and legs? Like that cracks me up and I can't get over it every time I'm watching that video. I'll keep talking and then whenever you can find that again. So in case you're like, what the heck, why did I show you that? Brian was representing all that internal stuff we don't like, our thoughts we don't like, our emotions we don't like. And one of the examples that we give in our group is like the aunt. There's always like a family member. I just wasn't sure, if my mom was coming, if I wanted to talk about our family members. I'm just kidding. But he's that, it's all those thoughts and emotions. It's that unwanted internal experience. And so the person was spending so much time trying to keep the neighbor out, right? He was not enjoying the party. All of his efforts and all of his energy was in this agenda to let me control this. And so he's trying to keep him out. And when he finally said, you know what, I'm going to let it be there. I'm going to focus on talking to my friends, eating good food. Like Brian wasn't so scary. Brian was there kind of doing his own thing. Okay. So that was a little bit more about like kind of this strategy. And before I do grounding techniques, I'll just kind of give you one, but part of the Brian and the unwanted party guest is what we call acceptance. And a lot of times when people hear acceptance, we have this idea of, but I don't want this. And the concept of acceptance and willingness isn't a, do you want it? It's a Yoda moment. It's do or do not. Like there is no try. So it's basically like, do I have a willingness to be where I am right now? Be that observer. Notice my brain is telling me this, and this is how I feel. Sometimes the answer is no. Then we're going to go try to do all the things to struggle and control it. But some of the metaphors they use to kind of get the idea of acceptance out is it's a passenger in your car, like it's driving in your car, or it's in your car as a passenger. It's not driving and making the decisions, because you can either drive towards your values or you can drive away trying to control your unwanted internal experience. So some of the metaphors are, can you carry it with you how you would a sobbing infant and still go about your life? I feel like story of my life, like, can I carry my children doing whatever they're doing and still live life? Can you give it a hug and hold it gently like you would a loved one? Can you sit with it and have it there with you while you're still living your life? Okay. And so 2 more things I want to do, and then we'll open it up for our questions. So grounding techniques, before we practice something, and don't worry, nobody's going to know if you're doing it. Before I practice, I do like to say a lot of times people will do these strategies and then they'll say, I don't feel any different. I do not feel relaxed. I still feel anxiety. And my answer is yes, because we're not trying to change that feeling state. We're trying to not let those feelings and thoughts guide you and drive your behaviors. So the point of this goes back to that mindfulness. We just want to train our brains instead of worrying on the anxiety train and going off the cliff with all the worried thoughts. We want to slow it down and be in this moment where we are right now, because it's the only moment we have to take an effective action in line with our values. So I'm just going to do a really simple one. And before I do it, it's okay if when I walk you through the numbers, you can't do all the things. I used to teach this, and well, I still teach it, but one person in my private practice one day was like, I couldn't smell 2 things, and it got her more anxious. That's okay. Basically, this point is our brain is going a million miles an hour with all of our thoughts. We just want to catch the train, and we want to slow it down to where we are in the moment. So I'm just going to walk us through a really brief technique, and I want you to just, if you're willing, give it a try. So you're just doing it all in your head. You don't have to say anything out loud. But the first thing I want you to do is I want you to just look around the room you're in and just notice 5 things that you can see. So 5 things you can see in the room where you are. Your brain's still going to wander. It's okay. Just bring it back. 5 things you can see. Now, 4 things you can feel. And that can be like your feet on the floor, where you're sitting in your chair, hair, your watch, whatever. So 4 things you can feel. Now, 3 things you can hear. If you listen closely, you can probably hear my children. 3 things you can hear. Now, 2 things you can smell. If we were in a room, I would say smell your neighbor. We're not in a room. If you can smell 2 things. And then finally, 1 thing you are grateful for. Now I'd ask you how to tell me how that was for you, but you're all muted, so we'll skip that part. There's a lot of different grounding techniques that's basically just using your senses. And it's a beautiful thing to do if you're outside. There's always things to look at, to smell, to see, to feel. And again, it's not to stop your brain. It's not to stop your thoughts, but it's to say, this is where I am right now. Because when we're looking around and focusing on our senses, it's slowing down our breathing. And that's the biggest thing in slowing down the anxiety, slowing down the fear, helping us untangle. Remember when we had our notebook We want to untangle from those thoughts. And then the last thing I want us to practice, because every time I forget to teach this in group and then I do it at the end, everybody's like, why didn't you do that at the beginning? So what I want for you to do, this is again, just inside your head, I want you to think of a statement that's like a negative, maybe fear-based, judgment-based statement that you have that starts with I am. I know this doesn't sound very fun, but I promise we'll get there. So I want you to think of a statement about yourself that starts with I am, and you're just going to say it over and over in your head for like 10 seconds. So I am, just say that statement. Now what I want you to do is add on to that. I am having the thought I am. So I am having the thought I am, insert your negative judgment. And now the last thing I want you to add to that is I notice I'm having the thought I am. So I notice I'm having the thought I am, negative statement. Okay. Again, I was going to like ask how that was for you, but it was kind of one of those things of I'm all caught up in my fear and I'm judging myself, because I forgot to mention the biggest piece of this is to do this without judgment. Super hard, right? Remember that brain judges us all the time. But we go from I am all of these horrible things and all these scary things, and I feel really scared and all of this is going to happen, that the more we add on to that, we're just noticing. I notice this is my experience right now. And so kind of the point of that is when we notice that experience, we get to separate from it. Now we're the observer, and now we get to choose. And that's what the whole hope of this is. You get to choose those behaviors that are driven more by meaning, purpose, value versus anxiety, depression, fear. Okay, last slide. I wanted to share this because this has been like my favorite. Oops, sorry. I'm gonna move you all over for a second. This has been like one of my favorite quotes lately. If you don't know who Viktor Frankl is, he is a psychologist, and he was imprisoned in a concentration camp. And so I think this ties it up beautifully for what like ACT-based therapy is. And again, there's a million strategies. I was trying to throw some at you from an 8-week group. And there's also an app called ACT Coach. So it's ACT Coach. The beautiful thing about ACT Coach is it goes through all of these. It has a take action section where there's all these barriers. If the thoughts are getting in the way, if the emotions are getting in the way, and it guides you through all of these strategies to help. So it's ACT Coach if you have any interest in that. But I love this quote because it says, between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. And so basically, stimulus, thoughts we don't like, emotions we don't like. Response, I'm going to eat all the ice cream. I'm going to stay in my room all day. I'm going to not go to an appointment. I'm going to shut out all my friends. So we're responding from that. But before that response, if we can create that space, that's where we have our power. That's where we get to choose what is that behavior that I can do that's in line with my values. And that's where we have our growth, and that's where we have our freedom.